Today's health headlines. Could a nose spray be the defense against COVID variants? A new preprint study on a universal COVID vaccine candidate and a report that only 18% of parents will get their young children vaccinated. Joining us is Dr. Arjun Venkatesh, Chief of Emergency Medicine Administration at Yale Medicine and Associate Professor at Yale School of Medicine. Doctor, welcome back.
Hi, thanks for having me.
Great to have you. So BA4 and BA5 are on the rise. These are the new ones we're hearing about. What can you tell us about a nose spray vaccine in development and if it might help with variants?
Every time we hear about a variant, we start thinking about, will I need another shot? Will I need a new vaccine? And these nasal vaccines could be very promising. It's very early right now. There's nearly a half dozen nasal vaccine candidates out there. Some of them have entered phase 3, which is the last phase of trials in humans to be tested, but they could be easier and more effective. That means no shots in the legs, and they could work right in our nose where the coronavirus initially seeds itself and attacks the body. And so if they work well, they could prevent us from not only getting severe COVID or pneumonia, but they could actually prevent us from getting COVID at all.
Any even guess on a time frame?
We're looking at months at this point, given that these trials have just begun. They have to enroll people from around the world and then publish results and go through the regulatory processes. It wouldn't be anytime soon.
All right. There's a preprint study out today about a universal COVID vaccine candidate. Tell us about this.
You know, anytime we make vaccines, what we always start with is trying to find a way to teach the body's immune system how to fight away a virus by finding parts of the virus that are part of the virus but not part of our body. And what some researchers have done is they've taken sequences or the genetic sequences of coronaviruses from around the world and found that they were able to build a model that was able to identify 305 different proteins that are on different coronaviruses but not part of our body. And if this could be used to make a new vaccine, we could have our first all coronavirus vaccine that wouldn't just work for the variants of today, but the variants of tomorrow or even new coronaviruses in the future.
Fascinating. All right. And finally, CNN is reporting that only 18% of parents are willing to get their children under the age of 5 vaccinated. What is your message to Connecticut parents if and when this becomes available? We're hearing maybe June.
Yeah, this was a disappointing survey to hear about, but I think the important thing to know is that it was 18% of parents were ready to get their kids vaccinated. The vast majority of parents in the survey said that they were waiting to see how it went for others. And there was a segment of that survey that said that they were sure they weren't going to get their kids vaccinated. For those out there who are going to get your kids vaccinated, tell your friends about it. Post it on social media. Let other people know, because other people want to see other folks they know with young kids get vaccinated as a way to do it themselves. I can tell you, I will get my 3-year-old son vaccinated as soon as it's available for him.
All right, in 15 seconds more, doctor, your message about boosters, because we're seeing the positivity rate go up, but not the hospitalization rate as high as it used to be.
That's because boosters are working. Here in Connecticut, we have a higher booster rate than the vast majority of the country. And boosters really prevent people from getting hospitalized with COVID. And so while we see thousands of new COVID cases, we only see dozens of hospitalizations. And so it's so important to help those around you and your family, yourselves, make sure you get boosted, because it's no longer considered full vaccination to just have a couple shots.
Excellent message. Dr. Arjun Venkatesh, thank you once again.